Breast cancer really doesn't just affect the woman who has the breast cancer, it affects those around her. And of course, we all know someone, whether it be our own mother, sister, niece, aunt, grandmother with breast cancer. Fortunately, we're able through the digital mammography to catch it earlier than many years ago. And because of catching it earlier, we can make a huge difference in literally the cure rates. Oftentimes a woman will not know that there's anything wrong with the breast until she has a screening mammogram. And so having those services available right here at Hancock Regional makes it much more convenient for the patient than to have to drive a much longer distance and have those other studies done. It's just the unimaginable to have young children and then have a mom who, let alone is suffering with breast cancer, but dies from breast cancer, especially when in many cases now through early detection it can be curable. Having the full spectrum of diagnostic and interventional tools all in one place just provides a tremendous continuity of care and a better package for that patient's overall well-being. You don't know when it's going to be you or somebody that you love who's going to need these services. Breast cancer and other women's health issues are going to affect someone you love, if it's not yourself, at some point. The earlier we catch breast cancer, the better chance we have of completely curing that woman and releasing her from this disease. And that means the world to her and her family.
I was a practicing veterinarian for 20 years. After my breast cancer, I had a lot of health issues related to the chemo, and I wasn't really able to go back fully to practice, although I tried. So I left veterinary medicine, did some volunteering at the hospital with my dog as a therapy dog, and then I decided, I really want to work with breast cancer patients. The statistics for breast cancer right now are that one person is diagnosed every 3 minutes and one person dies every 13 minutes. What if we could change that to where we are diagnosing more people earlier? Those intervals could all be shortened by having more coordinated care. So I think those are all major benefits of our new center. I think when the families of those women who face a potential diagnosis of breast cancer can feel confident that when their loved ones come to Hancock Regional, they're getting state-of-the-art care. With the digital mammography and the other resources we have here, they are getting equal care to any hospital in Indianapolis. Let's make that available for all women in our community and let them have their diagnosis here, where they can be cared for by their neighbors and friends and family doctors.
I guess it was the end of July of 2008 when the tests were finished and she was diagnosed with breast cancer. Well, on a very personal level, it was devastating to me because I thought she was going to die immediately. Without question, the most significant woman in my life is my wife, Lori. She is my best friend, confidant. There isn't anything in the world I wouldn't do for her. If Lori were not here today because of the cancer, I think the way it would affect me the most is that I have lost someone that is so dear to me. I wouldn't have that person to sit down in the evening and discuss the day's events, what happened in her life during that day, and relate what went on with me during the day. It's just a time of day that's between us, and I enjoy sharing that more than words can really convey to people, I'm sure. I guess I just don't take anything for granted when it comes to whether or not any of us are going to survive until tomorrow. Truly, from the deepest parts of my soul, I believe that this center is going to be one of the best things that's happened to Hancock Regional, the women in the community. One of the biggest things is the interaction between the women and the healthcare people that are there. Not only going to impart to them information and further resources, but it also causes a sisterhood, if you will, where they can interact with each other anytime. What an asset to the community.